and thanks very much. Thanks to everybody for coming tonight. We really appreciate the fact that so many of you have taken the time to join us. Makes it worth our while putting this together, and hopefully you'll all find something of interest in the meeting. I'd like to start really just by thanking really very much the two charities that, well, three charities actually, who are sponsoring the majority of our work, and I know are represented here tonight. Obviously, you can see the logos for the Dachshund Rescue Charity and Dachshund Health UK, both of whom are now really major sponsors of the work that we're doing here. Also, I know there are representatives of the Kennel Club here, and the Kennel Club Charitable Trust is a very significant sponsor of our work as well. We do have a couple of other charity sponsors that I should mention. That's the BSAVA charity Pet Savers, the Alice Noakes Trust, a small charity from Braintree in Essex as well. And we really appreciate all the help and the input that we get from our sponsors. I'd like to introduce you to our team before we get going, our little intervertebral disc team, which consists of Sam Khan, who's been doing a PhD for just over a year now, looking at various aspects of intervertebral disc disease. He'll be doing quite a lot of the speaking this evening. We also have Bruno Scalia, who is our latest resident, joining our neurology clinical team at Cambridge, whose residency is being very kindly sponsored by Dachshund Rescue. And then we also have Viviana Rojas, who has joined us since October to take on a one-year master's project looking at some very interesting aspects of intervertebral disc disease, again, sponsored completely by Dachshund Rescue UK. So without going too much more into this at the moment, I think we'll get going with Sam. And Sam, perhaps you could start the webinar off by just telling us a little bit about what we're talking about here. What is a disc? What is disc disease? And give us a little bit of an introduction.
Yeah, of course. Thanks, Paul. So I think if we want to understand what disc disease is, we need to understand a little bit about what a normal disc looks like. And I think if we first of all imagine what the spine is, the spine's kind of a series of building blocks, and those building blocks need to move against each other, and they need to do so without damaging each other and with as little sort of friction and things between them as possible. And so the body rather sensibly has put in between of those a shock absorber. So in between every vertebra, there's a little shock absorber, and that's the intervertebral disc. And in order to fulfill this function, it has two parts. It has an outer bit, which looks very much like your tire, hence the slightly odd picture of a tire, because it has lots of layers arranged at different directions to each other, which give it a lot of tensile strength. And that's there to hold in another bit, which is very gel-like and what actually confers its shock absorbing capacity. And if you imagine these put together, you know, an outer fibrous bit, an inner gel-like bit, and a little bit of imagination as well, it looks a little bit like a jam donut. And we'll come back to that in a minute. I'm not just doing it to tease everybody after dinner. So what happens when it goes wrong? Well, as time goes on and as dogs get a little bit older, they start to degenerate. And what this means is that the inner gel-like bit becomes a little bit harder. It becomes less able to absorb those forces. And certainly in a lot of the times, it becomes calcified as well. And this resembles a lot our kind of jam donut. If you imagine, it's difficult to imagine not eating the jam donut, but if you imagine leaving it out on the side in the kitchen for a few days, you can imagine it becomes a bit stale. The inside jam becomes a bit crystallized. And then when it's not able to absorb these forces, what can happen is the jam gets squeezed out of the donut. And this effectively is what we talk about when we talk about a disc extrusion. That's kind of what it is. It's the jam being squeezed out of the donut. Some people will term it a slip disc or something like that, but effectively it's where the inner gel-like component has come out with force and collides with the spinal cord. And because the spinal cord's got nowhere to go, this does two things. It hits it and it bruises it. and then some of it remains there and compresses it. And each individual extrusion is a unique combination of these two things. So I like a visual kind of way of things. So that's kind of what these pictures at the bottom are here to demonstrate. It hits the spinal cord, it bruises it, and then it sits there and compresses it. And that's really what a disc extrusion is.
Perfect. Thank you, Sam. Bruno, as the clinician in our team, perhaps you could just tell us what sort of dogs are likely to suffer with these disc extrusions, and if we think that our dog maybe has one or is suffering with one, how would we recognize that?
Yeah, of course. So there's different types of dogs that can suffer from disc disease. The most commonly affected are those breeds which are part of the chondrodystrophic group. Chondrodystrophic is a bit of a fancy word to basically describe those dogs whose discs tend to sort of age a bit quicker than they normally would. And when I mean age, they basically tend to become dry and, as Sam was saying, harder and calcified earlier in life, which basically means that at a younger age, so at the age of average of 5 years potentially, they can slip a disc because the shock absorbing capacity that they normally have is obviously less than normal because they're much drier than what they normally be. The median age is indeed 5 years, but in certain breeds especially, disc diseases occur in younger dogs, even from 1 year of age. And in a miniature dachshund, we know from a study that thoracolumbar intervertebral disc herniation, so a slip disc basically, has a prevalence of about 20%. And within this group, it's fatal in 1 dog out of 4. So if we do some calculations here, we can work out that basically 5% of all miniature dachshunds will die of intervertebral disc herniation. When it comes to recognizing the signs of this problem, that it can come in different ways. The first sign usually is pain. Dogs can show pain in a very different way. They can yelp, which is the most obvious, obviously. They can show, they can pant, they can be lethargic, they can be not willing to stand, to get up, to walk, which is usually the early signs that you notice. As things progress, I mean, in most cases at least, you start noticing abnormalities in their gait. Most typically, if the problem is in their back, abnormalities with their back limbs, they start becoming wobbly. They become more and more wobbly to the point where they can't support their weight on their back limbs, and to the point where they're dragging their back and their back limbs, and to the point eventually where they lose feeling on their back limbs. The progression and the onset of these signs is very, very variable. That's why Sam was saying every extrusion is unique, because these signs can be very variable. And I have 2 very nice, well, one is an image, one is a video of this. On the left-hand side is a very nice taxi with a kyphotic posture, we say, the arched back, basically, which is a posture they have to try and relieve pressure for your hurts. So relieve pressure from their back, basically. And that's something that's very commonly witnessed and reported from owners who have dogs who are suffering from IVDD. And on the right-hand side, there is a video that should maybe start now. Perfect. So in this video, you can see this dog is clearly not walking normally. His back limbs are kind of swaying. He's really, really wobbly. And at the very end of the video, he almost falls to the left-hand side. And this, again, a sign you can notice usually at the beginning of the of IVDD, when things start to go downhill.
Perfect, thank you. So, yeah, as the slide says, and as the amazing picture of the little Daxi, who's very worried about intervertebral disc disease, clearly, what should we do? What should owners of Dachshunds and any dog that they think might be suffering from intervertebral disc disease, what should they do, Bruno?
So there's different options. I guess the first thing to do is, if you see your dog looks abnormal, in pain, or walking a bit weird, I'll probably contact your vet as a first step. First of all, have your vet assess your dog. Make sure it is truly IVDD, because, as I was saying, especially at the beginning, the signs are very non-specific and they can mimic other things. So make sure we are on the same page as to whether this is IVDD. And then your vet will decide as to whether they feel the dog needs to be referred to a specialist, whether they're happy to manage the patient themselves. And then depending on many factors, we can always opt for medical, so-called conservative management, so non-surgical management or surgical management. If we do surgery, we basically aim at removing the disc material that's come out of the intervertebral disc space and basically decompress the spinal cord. With the medical management, we mostly aim at giving time for the swelling to subside and resting the dog properly, as Sam will describe a bit later on, mostly to prevent more disc material to come out from the space and further cause further compression and further damage. But indeed, obviously just not the end of the story, and probably regardless of whether we treat our dog surgically or medically, the post-hospitalization care is equally important, and it's actually quite similar. Next, please. So home care is quite similar, as I was saying, regardless of whether you opt for surgical or medical management with your vet or with specialists, and it broadly consists of 5 parts as listed here. So wound care, if there is a wound to care for. Obviously for medical management, there won't be a wound to care for, but pain relief, strict rest, and the physiotherapy will be present pretty much in all patients. Bladder management will be probably an issue or something to care for, more than an issue really, in those dogs who are more severely affected. And when we start by talking about wound care, so if your dog has had a surgery, you want the wound to look as nice as possible. And when I say nice, I mean I'd like to see no redness, no discharge, and no swelling. And I'd like to have the stitches, if there are stitches to be removed, I would like them kind of looked at, making sure they're still keeping the wound together and the wound is not opening. There's nothing that looks abnormal, just healing normally. And depending on the surgery, there can be stitches need to be removed 10-14 days after the surgery. They can be internal, or they may just not need to be any specific care for it. But most of these are the things that I really advise to keep a very close eye on: redness, swelling, and discharge, and wound breakdown, and make sure the wound is clean and dry. If you do notice any of these things, don't ignore it, because an infection on that side could become a serious issue. So let your vet know, let us know, let someone know, and we'll help you out. And the next step would be pain relief, equally important, because IVDD is painful. And most dogs will be prescribed a bit of a cocktail of medications, because pain relief, kind of different medications act differently. So the most commonly drug you will probably be prescribed is non-steroidal anti-inflammatory medications. The most commonly probably is meloxicam, which many dogs have had in their life anyway for other things. Gabapentin and paracetamol are other drugs that we tend to use because they act very differently. Gabapentin, as many of you may know, is a very good pain relief for the nerves basically, and paracetamol is very commonly available. So I think we're all familiar with its very nice effects as a pain relief medication. And by using a combination of this medication, we manage to kind of counteract the pain from all the perspectives and all the sources it's coming from. But always make sure that these medications are prescribed and given by a vet, as in, if you find yourselves with some paracetamol at home, I would not just give it because you suspect your dog has IVDD. I'd rather have the vet assess the patient, assess the dog first, and then the vet will be able to advise you as to whether paracetamol is indicated in the first place and how much and for how many days and so on. So don't improvise, just ask for advice, because we're more than happy to advise on that.
That's great. Thanks very much, Bruno.
Always.
So, Sam, maybe you can tell us a little bit more now about the medical management. That's what we want to focus on, how people should look after their dogs once they've had a diagnosis of intervertebral disc extrusion, whether it's had surgical or just medical management. What are the important bits that we need to focus on there?
Yeah, of course. So as Bruno's already alluded to, the management for medical and after surgery is pretty much identical. and still consists of these 5 parts. And the rest, the bladder management and the physiotherapy, I want to take each of those individually and just spend a bit of time explaining what exactly we mean by that. And for the rest, if we kind of go back to the beginning and imagine that we've had the jam squeezed out of the donut, if you imagine we now have a hole there, what we don't want to happen is for more jam to come through that hole and damage the spinal cord any more than it already has done. And so to try to minimize that risk, we would usually recommend 4 weeks of really strict rest, either in a crate or a very small pen. That literally is just aiming to do that. It's not really aimed at anything else. And we get a lot of questions about this, Kadra, so I kind of want to take each of them in turn, and I think that's the best way to make sure we get it all across. How much time should they spend there? Should they be in there all day? Unfortunately, the answer is pretty much yes, unless you're bringing them out for a very specific purpose. For example, to do their physiotherapy or to express their bladder, they've got to be in there, because otherwise, you know, the risk of them doing some sort of movement which is going to risk more jam being squeezed out of the donut is a bit more. So unfortunately, we've got to be pretty strict, and they've got to spend a fair amount of time in there. How big should it be? Well, if they're spending a long time in there, we need to make sure they're comfortable while also minimizing this risk. And so we want it to be big enough that they can stretch out, high enough that they could stand up, and big enough that they can turn around, but not really much bigger than that. We don't want them wandering around and hurting themselves. So just about enough size for them to lie in all directions and stand up. Any bigger than that is probably too big. What bedding should we use? Well, again, we've got to make sure they're comfortable. So we want it to be supportive and we want it to be soft, but it also needs to have a few more functions. Certainly there's a risk with dogs with IVDD that they may not be able to urinate, or that they may not be able to have full control over where and when they urinate. And so we've also got to consider that our bedding needs to be absorbent and soak up any urine. And importantly, they may not be able to move away from it if they urinate. And so we want to have a bedding that kind of does that for us, that wicks it away, so that they're not sitting in urine and potentially getting urine scald. The other thing we want to prevent is pressure sores, but this is pretty uncommon in small dogs like Dachshunds. It's really very unusual. But again, just having soft bedding that's really nice and supportive is usually more than enough to get on top of that. The one thing that I think is important to note here is puppy pads are one of the most commonly used things, and certainly we use them here at Cambridge, but you do have to be quite careful. If they do urinate on them, they're great at absorbing that urine, but if they then start to move themselves across it, it can become really abrasive and can damage the skin. So just a sort of note of caution there. If we think about how often they're having to spend in the crate, it's important we also consider enrichment. We don't want them to be bored. If we just stick them in a kennel and expect them to get on with it, they're going to cause trouble. And we're certainly not going to have a well-rested dog. So it's important we give them something to occupy them. But it's important that we don't give them stuff that they're going to be shaking or could potentially get stuck. So we want really hard wearing toys like Kongs and things like that, or snuffle mats, all kinds of things like this, which are really useful, keeping them occupied without them being too active. You know, things like Kongs, you can freeze them and things like that, which will help them last a bit longer. So they can be really handy. I said pressure sores a little bit earlier, and I think it's important we just take a moment to consider them, even if they're not very common. But effectively, they're little wounds that happen mainly over bony prominences, where effectively, if you've laid in one place, you've stopped the blood from getting to it. And so the skin dies, and if, you know, eventually it can affect the tissues under the skin as well, like the muscle, when you can get a little trapped there. So they normally start very superficial. The important way to sort of prevent these from happening is to have really supportive and soft bedding. And if your dog hasn't moved themselves or is not capable of turning themselves, just to turn them every 4 hours or so. You know, you don't need to be staying up at night with a Dachshund. It's certainly not that common a problem, but just during the day, making sure that every 4 hours they've been turned is usually more than enough to prevent these from happening. And if you do notice them, just let your vet know, and they can let you know how to manage that and hopefully get on top of them really nice and quickly. I think the last thing to consider with the crate rest really is urine scald. As I said, lots of dogs who have IVDD will not be able to urinate on their own, and the mainstay of preventing urine scald is actually going to be bladder management, which we'll come back to. But it certainly is part of crate rest. And the main thing to do here is to make sure that the bedding is absorbent. Make sure you check it really regularly. That's really the key. Whatever bedding you've used, nothing is going to withstand being urinated on constantly and not checked. We've got to keep an eye on it, keep changing it. And if they do get any urine on them, make sure you clean them thoroughly. If you do clean them, make sure they're not wet. So use something like a baby wipe that's going to still be fairly dry. And if you do notice any redness, usually urine scald happens between their back legs or on their belly. If you do notice anything there which you're concerned about, again, just contact your vet. It's something that they can advise on, and hopefully, again, the sooner you get on top of it, the easier it is to treat. Lastly, just a few sort of random bits of advice, that I've kind of picked up over time. The first one is to try to get your crate long before you need it. If you're just starting to use it once they have a problem, it's usually much more difficult because they've got to get used to it. Whereas if they're used to it already, they're happy with the crate, then it's a much less painful process trying to get them used to it. The other thing to consider is when you're buying the crate, in a lot of examples, you'll be buying it when your dog is able to walk in and out of it very easily. And so you're probably not going to consider how they get in and out. But it's important that we just think about this, because some crates is actually quite difficult if your dog's not walking in and out of to lift them in and out of safely. And so just keep that in mind when you're buying one, how you're going to get them, how you're going to get hold of them safely. Be aware of where you put the crate. I know we don't want it under our feet, but equally so, if you stick it in a corner of the room, it's likely to be somewhere that may be drafty, might be a bit cold, might be a bit dark. Think about the sunlight it might be getting. We don't want them in the middle of summer in really bright sunlight all day, because they're not going to be able to move away from it. So just think quite carefully about where we place the crate to make sure that it's somewhere that's going to be comfortable at all times. Lots of people ask me about using pens, and in lots of ways they appear like they might do the same job, and they probably will, but the important thing is you have to guarantee that your dog will not try to jump out. Even dogs who cannot walk will still often give it a go. So unless you can 100% guarantee that they're not going to try and jump out the top, it's important that you use something with a lid. And the last thing is just to have something on them that you can sort of get hold of them safely with. And I find a harness is pretty useful, especially one that has a handle or something. Many of you, if you've had dogs with IVDD, will realize even when they can't walk, they can still get past you pretty quickly. And what you want to be able to do is to not sort of have to just grab them anywhere. You want to be able to do that in a nice controlled manner. And so often keeping a harness on there can be a really good idea. Just make sure it's one that's really nicely padded and that you check to make sure there's not any redness underneath or anywhere where it's rubbing. If we move on to bladder expression, so as we've kind of said before, many dogs with IVDD won't be able to urinate, and so we have to do it for them, because otherwise what can happen is urine retention can lead to urinary tract infections, or in the most severe examples, if they just don't pass any urine for a long period of time, the bladder can become stretched and damaged to the point where they will never become continent, even if they recover in all other aspects. So it's important we do this really regularly, and normally recommend between 3 and 6 times a day. There's multiple ways you can do it. There's no single correct answer, but this is kind of the way that I would tend to do it. So you can do it with them even stood up or lying down. And what you do is you use the flat part of your fingers to press very softly on their abdomen, and you just gradually increase the pressure. You never release it, but just gradually keep increasing it until you can feel that taut balloon, which will be their bladder, and then just constant pressure on it until it's completely empty and no more can be expressed. Sometimes this can be really difficult, and sometimes because of the problem in their back, it seems slightly strange, but it can lead to increased resistance, and sometimes they require medication just to make it a little bit easier, but that will always be prescribed by your vet. So if you're worried about that, just ask them. I think the most useful thing probably is for me to show you a video. It's a bit of a strange thing to try to explain just with words. And so this very kind volunteer is just going to demonstrate where I kind of place my hands and what I'm aiming to do. So as you see, stood up here, I've got my fingers pointing downwards and quite rigid and straight out. I use my little finger to come up into his hip to support his weight and have him stood in a nice position, and then just gradually increase the pressure. And then on the right hand side is how you do it with one hand. You know, for small dogs like mini Dachshunds, certainly you can do it with one hand. For slightly bigger dogs, sometimes you need both. And that can be really quite useful. And so you just can do it like this. The important thing is that you just take your time doing it and, you know, go really slowly. And the other tip, I think, is to, once you feel like you've expressed everything, just give them a second and then just have another feel, because sometimes there's a little bit more in there and we want to get it all out because urine retention can lead to urinary tract infections. So just have a second go, because more often than not, you'll be able to get just a little bit more out. So that's usually pretty helpful. The last thing is physiotherapy. And certainly we're not an authority on physiotherapy, and it's far too big a subject for just one webinar. So, you know, we're just going to try and pick up on some small things, but physiotherapy can be really useful for dogs with IVDD. It can help with a real range of things, as I've listed here. And, you know, if you do physiotherapy, you can adapt that plan as things go on, depending on your dog's progress, how severely affected they may be at various different points in time. But we would pretty much always recommend massage and passive range of motion. And these are very basic exercises that you can do without any specialist equipment. And they can help in a number of ways. They can help with things like muscle contractures. They can help with blood flow to those back legs, all things like this. And they're super safe to do, no matter how severely affected your dog is or what stage you were at of the recovery process. But just to kind of reiterate, you know, if there's one thing you take from this physiotherapy section, it's that if you have any questions about this, contact a qualified veterinary physiotherapist. They may be vets who have then trained in that way, or people who have done specific qualifications, but they're usually very easily, it's relatively easy to find them, but it's always worth contacting them, and they can help you no matter what stage of the process you're at. If we come back to massage and passive range of motion, I just want to pause on those for a minute and just show you a video that's for each of them that's been supplied to us by Synergy Small Animal Rehabilitation. They've very kindly done this video for us. And firstly on massage, if that will play. And so here he's just demonstrating how to do it, starting really nice and superficial. And then as he goes through, he will eventually start to focus more on individual muscle groups and making sure they're all really nice and relaxed and not tight. If I can just skip through to that. If anyone wants to see the full version of these videos, they are available also on our Facebook page, which is at Cambridge IVDD. And so here you see he's moving on towards the more specific part of it. So I'm just going to skip ahead. As I say, if you want to see the full video, you can go to our Facebook page. And lastly, passive range of motion. So this is effectively where you're moving the joints through their full range of motion really slowly. And the important thing here is to do it nice and slow, as Matthew's demonstrating here really nicely. Trying to loosen up all these joints, get the muscles moving. And if you'll notice, for both of these, he's got the dog lying on their side on a really nice supportive, he's using an orthopedic mattress there, but any supportive surface will do, so that no pressure is being put through their back. So yeah, thank you to Synergy for that. That's everything that I wanted to talk about physiotherapy. As I say, if you have any questions about that, it is always worth just contacting a qualified veterinary physiotherapist.
That's great, Sam. Thank you very much for that. A very full and complete run through the really important aspects of medical management or post-surgical management as well, as we said. So thanks for that. I'm sure there might be some questions later on. Well, we've been going for half an hour or so. I think what I'd like to do now is just to ask Sam and Viviana to tell us a little bit about the research that we're doing that's been forms a big part of the work that we're doing at Cambridge now, looking at various different aspects of disc disease in Dachshunds as well as other breeds of dog. And so maybe, Sam, if you want to kick this off again, as you've been doing the research for the longest, and just tell us a bit about the study that you're involved with.
Yeah, absolutely. So I've spent the last year really looking at conservative management very specifically. And what we've been doing is we've been taking dogs who are less than 15 kilos, who are suspected to have disc extrusions in the middle of their back, thoracolumbar just means in the middle of their back, and who have lost the ability to walk, and very specifically whose owners are unable to afford surgery. And what we do is we offer 2 consultations, 12 weeks apart, with MRIs at both visits, with assistance, virtual assistance in between for conservative management. So we advise on all the things we've kind of been through today and adapt those plans as these dogs go on. And what we found is that lots and lots of dogs will get better, which is great news. But in order to find out exactly who is most likely to get better and exactly how many, what sort of percentage recovery rate we have, we need a lot more participants. So we're still really recruiting for this, and we would, we're looking for more people and dogs in this scenario to come and be part of this study. But certainly the results so far are pretty promising. And really our end goal with this is to hopefully be able to compare the rate of recovery, as in how many will be recovered, but also how quickly and how completely dogs will recover with surgical and conservative management. And our aim is so that we can then direct each of those 2 different treatments, if you like, to those who will benefit the most from each of them. And we're a little way off that. Obviously, as I say, we need lots more dogs, but we're edging closer every day.
And how many dogs have actually been through the study so far, Sam?
So far we've had just short of 50. I think we've had 48 dogs come so far, which is great in only a year. And we probably are looking to get a similar number this year. That would be a really good, really successful for us, I think, if we had the same again.
And if people think that they may be a candidate, how should they go about getting in touch with you or getting in touch with us?
Yes, there's a few ways that you can get in touch with us. Firstly, your vet can get in touch with us. They can call reception here at the vet school in Cambridge, who will always be able to put you through to me. You can contact us through our Facebook page, which is at Cambridge IVDD. You can contact us directly on there, or there's our contact details available on there, and you can email me directly. And so either of those is fine. We'll always try to get back to you as quickly as we can.
Perfect. Thank you. Thank you. Okay, well, last but not least, Viviana, who has just begun her master's project here. Maybe you can tell us a little bit about the work that was done last year and the work that you're planning to carry on this year, Viviana.
Yes, thank you. Well, I am going to explain you very quickly about our master's project. Basically, what we are doing is, next please, next. We are studying the intervertebral disc disease, but this time at a very microscopic level. So we are focusing, next please, this little part, which is the material that extrudes into the vertebral canal. And we are taking those samples and analyzing also at the same time samples that we have from discs that are healthy, that are also part of the surgical treatment, obtaining those samples. And we are using different techniques in order to evaluate what we find in those samples, in those types of samples. So far, we have found very important difference in terms of calcium. Over the last year, the previous student collected more than 100 samples, with more or less 57 patients, and as expected, Dachshunds have a high prevalence in this population. So next, please. What we are gonna do now, or what are our plans for this year, is basically continue a comparison of affected discs versus healthy discs, collected as many samples as we can. Next, please. We would like to identify important differences between healthy and affected discs in terms of mineral content, in terms of imaging findings, as I can show you here is ACT, and physical properties using different techniques. As I mentioned before, most of those properties at a microscopic level. Why is this important, or why we are doing this? Is because I think we all hope to put an end and a stop to this situation, and we would like to contribute to the identification of discs at risk before the disease has developed. In the future, we would like to design strategies to prevent the degeneration of the discs, and hopefully our research will improve the therapeutic options for those dogs that are affected with intervertebral disc disease once we understand more what is happening or what is going on in those discs. So that's basically what we are doing in the masters.
Perfect, thank you very much. So as you can see, hopefully from that little summary, where our research is really aimed at trying to improve the treatment of dogs that are affected already with disc disease, which we know is a significant number of dogs and an ever increasing number of dogs, it seems to be. But also, particularly through the Masters Project, we're hoping to try to find ways to actually prevent this disease from happening in the first place, or at least reduce the frequency that it happens. And so it's a bit of a two-pronged attack on this horrible disease. Anyway, thank you so much to our participants. Thanks to Sam, Bruno and Viviana for that really, I think, good and comprehensive talk through a little bit of the information that we have now on intervertebral disc disease. We haven't gone too much into the research and the findings of the research, but that's something that's really developing, and we hope we're going to have some exciting findings over the next year or two that perhaps can really change this, and maybe wouldn't it be nice if in a few years' time we didn't need these webinars on how to manage dogs with discs anymore, because the incidence had dropped down so much, perhaps because of some of the research that we're doing. Anyway, I would like to open it up to questions now. I don't know whether anybody's been typing questions into the chat box, Ian, but perhaps I don't know whether it may be better to stop the screen share now and then hand back to Ian, who can sort of pass on any questions to me, and I can either answer them or select the relevant victim to answer them.
Great, thank you very much, Paul and colleagues. Really appreciate the presentation there. Paul, I've only got one comment in the chat box so far, but okay. If anybody else has questions, please do type them in and we'll pick them up. The comment from Aileen Richards: my little dog was operated on 17th of March 2020. The vet says she's now lost muscle mass and she should be put down, but she's interested in everything, continues to be a first-class guard dog, which it would, being a Dachshund, no doubt. Yeah. Eats like a horse, loves her stroller. She can walk with a ginger lead, and I think she's lots to live for. Please, could you comment? I know you can't comment on dogs without seeing them specifically, but a general comment on that sort of situation, Paul?
Yeah, I'll probably comment on that one. Yeah, I was going to say, I think you have to understand we can't comment specifically on any individual cases. I'm sure there are some people who've been watching who've got dogs who either are affected or have been affected, and it is important to say that we don't want to interfere or comment specifically. What I would say is that I think quality of life can be measured in many different ways, and certainly the picture that Viviana showed of the little Dachshund in the cart at the end is something that can give permanently paralyzed dogs, because unfortunately some dogs affected by this disease are permanently paralyzed, and at this stage of our understanding, we can't cure some of them. And they are left permanently paralyzed. And some of those dogs can go on to live a perfectly reasonable life on a stroller, with the help of a cart, to give them back their mobility. So I think it's just important to really think about, the quality of life as well as the quantity. And perhaps, another discussion with your vet might be in order, perhaps a little bit more of an explanation or an understanding of what the prognosis is, whether there's any pain involved. Obviously that's an important factor. Usually the pain subsides, usually the pain can be controlled, but in some cases, there can be chronic pain, and that can be an issue, obviously. But I think that's perhaps one to have another discussion with your vet about.
Thanks, Paul. And Aileen, if you're not a member of our IVDD Facebook group, there's lots of support from people who've been through or are going through similar situations with their dogs. So please do join that. Dachshund IVDD on Facebook. Paul, there's another question about a dog that's been operated on recently. We had a very active standard Dachshund until 2 weeks ago when he had surgery for stage 3 IVDD. Once his crate rest and physio is finished, would you recommend any lifestyle changes for him? He's very active and getting him to slow down is difficult.
Yeah, I think, the whole point of our treatments, whether they're medical or surgical, is to try to return our dogs to a decent and should we say normal quality of life, and that includes a decent level of activity. And certainly, there is some research that shows that activity can be a little bit protective against disc disease. So I think, it's about being sensible. It's about not letting them do things that are increasing the risk significantly, but at the same time, getting back to a reasonable level of activity and sort of normality, I think is important, and something that hopefully you can expect to happen.
Okay, thank you. There's a couple of questions on prevention. One from Susie Finkel. How would you advise new owners who are worried about their dogs developing IVDD? I see many who are wary of allowing them to do much at all and worry that being too careful may be counterproductive. I would certainly agree from our research from our 2015 study, the dogs that get more exercise or were more active certainly seem to have a lower risk of IVDD. Are there any other preventative strategies, Paul, that you'd be recommending?
I think at the moment we don't know enough to be able to really talk about preventative strategies. I think probably the one factor that we would agree would be preventing your dog from becoming overweight. I think carrying too much weight certainly is probably a significant risk factor. It certainly makes recovery more difficult if your dog should suffer with disc disease, whether they have surgical or medical treatment. We do find that the dogs that are heavier, certainly take a lot longer. It's much more difficult to get them mobile again. So keeping the weight down, I think, is probably the one most significant factor. I can see loads of questions now, Ian, popping in there.
There's another one about diet and supplements, and certainly our 2015 survey, there was no relationship between any of the diets or any of the supplements that made any difference. The other significant factor other than exercise and keeping dogs active in that survey was avoiding early neutering. So we've got a couple of peer-reviewed papers that are published that suggest please don't have your dog neutered or your bitch neutered before the age of 12 months as an absolute minimum, and really that is another potential protective factor for that. Research question from Victor Zapesi. In terms of research, is this through screening and breeding from dogs? And Paul, you're one of the evaluators on the screening program, so it'd be really helpful if you could just say something about that as well, please.
Yeah, absolutely. Recently, the Kennel Club has launched a new screening program for Dachshunds, where you can basically take your dog to a number of different centres to have x-rays performed between the ages of 2 and 4 years. And what we're doing is we're then evaluating those x-rays for the presence of calcified intervertebral discs, and then grading them according to the number of discs, and then providing breeding advice based on work that's been carried out previously, mainly in Scandinavia, where these schemes have been operating for a number of years. And at the moment, that's the best scheme that we've got, and certainly the best advice that we've got in terms of breeding coming out of that scheme. And I would encourage anybody that's thinking of certainly breeding a Dachshund to look into that scheme and think very carefully, and hopefully get your dog x-rayed and scored before going ahead with breeding. In terms of genetics, we do have a genetics group now working with us here at Cambridge, and that's an area that certainly has been looked at in terms of the Dachshund. A specific gene mutation has been identified that's associated with disc disease, we know. Unfortunately, this particular insertion or mutation or variant is pretty much ubiquitous. It's present pretty much, as far as we understand, in every miniature Dachshund in the UK, and therefore it's not a particularly useful sort of screening tool for us at the moment. We are, particularly with Sam and his PhD, working with this genetics group to try and look at potentially other genes, other screening tools, both in the Dachshund and in other breeds, that we're, obviously the idea would be to try to find a test that could be done that identifies those dogs that are at risk, and particularly to try to it's one of the strategies to try and reduce the incidence of the disease.
Thank you. And those of you who want to find out more about that DNA test that's available, we have a page on our IVDD website, dachshund-ivdd.uk. And if you look at the screening page, there's a page and an article all about that DNA test. And as Paul says, virtually every Dachshund that we've looked at in the UK is homozygous for the mutation. So we really can't use that as a differentiator in terms of risk. I've got a chemistry question, which probably is for Viviana, I suspect. I'm an M-Chem graduate. What differences are you expecting to see from the FTIR, TEM and XRD? And if you could get any more three-letter abbreviations in there, Viviana, we'd be really appreciative of knowing what they mean.
Okay, yes, I didn't give too much detailed information because it can be complicated and I will confuse you more, but basically the FTIR is our first tool in order to identify like qualitative aspects of the disc in terms of biomineral content. So that technique gives us information about chemical groups that are different between extruded discs and healthy discs. So far, we have found differences in terms of calcium, and we aim to describe in more detail this year those differences. I won't explain too much the results because I will just present too many numbers and graphs, and it's not the moment maybe, but that's the first intention with the FTIR. We are also using different techniques. This year we were gonna start using atomic force microscopy, which will give us more information about physical properties of the sample. With XRD, we analyzed other aspects of the mineral content. And with the electron microscopy, we basically have a better topographic idea of what makes different an extruded disc versus a healthy disc. So the reason why I didn't explain too much those techniques is because it's very complicated, but each one gives us information about the mineral content and the physical appearance of those samples. That the idea is identify what makes them different between each other.
Thank you. And Connor, I'm sure you can look up Viviana's email address on the Cambridge Vet School website and have a chemistry conversation if you want to do that. I think I've got a surgery question, which is probably for Bruno. A disc that's been fenestrated, can material between the disc appear again?
I'm muted. So once a disc is fenestrated, we don't expect more material to come out of it. I think what we should probably say is that when it comes to approaching a disc surgically with a fenestration, you can never be sure of the amount of discs you're removing. Your aim obviously is to fenestrate probably the disc that has had the issue, to remove as much material as you can from that disc to try and prevent more disc material to come out at the same site. And when you're fenestrating other discs, it's pretty much the same principle, just obviously preventing those discs from extruding, so you're slipping in the future. So once you remove that material, you probably don't expect more material to reappear in there. I'm not sure, Paul, if we have any specific evidence looking at this to answer this question. It's just my feeling from anecdotal experience.
Yeah, I think what we know is fairly well that fenestration does reduce the risk of a disc extruding. So personally, I'm quite a proponent, as my residents will know, of fenestrating discs to try to prevent extrusions in the future if we are going to do surgery. It's definitely not 100% effective. It is quite a difficult technique, actually, and which is why it's not necessarily the most popular technique amongst surgeons. But the evidence is there that it is effective at reducing the risk of extrusions in the future, but it's by no means 100%.
Great. Thank you very much, both of you. A couple more questions which are around sort of prevention and activity. Adam Cross, is there any particular activities that can increase risk, such as playing fetch when dogs stop and turn rapidly when they're running? And the second one, our 1-year-old Dachshund's very athletic, no stopping him running up the stairs or jumping on the sofa, very fit, not overweight. Do you recommend trying to stop him being so active to prevent IVDD?
Kind of impossible to answer, to be honest, because we don't really honestly know. I think, common sense would say that the more the spine flexes and extends, perhaps the more likely a disc is to extrude once it has got to the point where it's kind of ready to extrude, where it's degenerated enough to be ready to extrude. So, in terms of sort of fetch, in terms of stairs and steps and things like that, I think it would be reasonable to suggest that perhaps too much jumping, climbing, steps and stairs, etc., probably is sensible to try and avoid that or reduce that to a minimum level. I think fetching a ball, is probably more about stopping and starting, and maybe there's a bit less risk with that, but honestly, I'm speaking purely from, just kind of trying to think about the mechanics of it rather than having anything that really supports that evidentially. A lot of people associate a disc extrusion with their dog doing something, jumping down off the sofa, chasing a ball or something like that. Actually, many of these extrusions happen, when the dog's not doing anything. It may be that some of them are associated with over-exercise, many are not.
I think anecdotally, our experience also would be that very few of them are directly attributable to a dog jumping off the sofa or down the stairs or something. Quite often they just wake up and their legs have gone first thing in the morning. And there was a paper published, I think in Denmark or Sweden, quite a few years back, that suggested that dogs that went up and down stairs actually were less likely to have calcifications and herniations. So it's absolutely a grey area, isn't it, really? But keep them fit and don't allow them to become overweight. Two of the key tips that you've already mentioned in there. There's another question in terms of sort of lifestyle, use of collar or harness. Any evidence which is better in terms of IVDD prevention? And again, our 2015 survey suggested that there really wasn't any conclusion that we could draw between the two of those. Might be worth you commenting, I don't know, Sam, about harness versus collar in recovery?
Yeah, look, from our point of view, it doesn't make a huge amount of difference. The main difference would be if your dog has a disc extrusion in its neck, then we would be absolutely against a collar. other than that, we really don't have a huge amount of preference. You know, inevitably, if you're having to help them in recovery, you've probably got things like slings and things like this, and then really that all that's doing is giving you a little bit of control of the front end. So, you know, unless your dog has a disc extrusion in the neck, we probably don't have a strong preference either way.
Okay, thank you. And Sam, while I've got you there, there's another one that I think is for you. You talked about bladder control. Question from Angela Downing. Could you talk us through bowel management in paralysed Dachshunds who's made a good recovery with pelvic limb movement but suffers from bowel impaction 1 year on?
Yeah, I mean, that's pretty difficult because there's a number of reasons why that might be the case. You know, some dogs require laxatives long term, some may even require intermittent enemas, some will require a change of diet to a high fiber diet. So I think in that instance, it's probably worth just speaking to your vet and trying to get to the bottom of exactly why and what's going on that's causing that to happen even a year on, even though otherwise recovery is good. So it's certainly worth just trying to see what the specific reason is to see if you can troubleshoot that. Otherwise, it's a lot of symptomatic care, things like laxatives and often diet changes and various other medications, maybe things like cisapride.
Okay, thank you. And a comment from Liz Wharton, who I know is member of the ABS team at the Kennel Club. Please note that IVDD screening is now a recommended test for Kennel Club assured breeders. So thanks for that reminder, Liz. And this is probably going to be the final question as we're coming up to 8 o'clock, Paul, from Brian E. Fawcett, who I know is a vet student, so be very careful with your answers to this one. With the research that Sam is carrying out, will you be assessing the different stages of IVDD alongside the conservative treatment outcomes to give a reference for vets to advise on which pathway to go down if money or insurance allows for owners? Want to pick that one up, Paul?
Yeah, absolutely. We certainly are. That's kind of our eventual goal. That's the real long-term thing, and whether we'll make that get to that point within the next couple of years, I'm not so sure. It's important to note that we are only looking at dogs who are unable to walk in this instance, so those who will be grades 3, 4 and 5, and so, you know, our findings have to be very particular to that, and to those who are affected purely in the middle of their back we couldn't, for example, extrapolate to those who are affected in their neck. So yeah, that is our eventual goal. There is already quite a lot of data out there about conservative management for dogs who are able to walk, so grades 1 and 2, for people to go and have a look at. You know, I don't need to summarize it here, but yeah, I guess the gist of it is absolutely that's what we'd like to do. We'd like to be able to say that, you know, for dog X who is a certain age, is affected to a certain amount, their chance of recovering with conservative or surgical management is this, the rate of recovery you can expect is this, and the completeness of recovery is this. That would be our eventual goal, but like I say, I think we're a little bit off that. We probably won't achieve that in the next couple of years, but hopefully in the not too distant future.
But you've got some really promising results already in terms of recovery from grade 4 and grade 5 dogs. And we have a couple of webinar presentations already on our website from previous webinars that Sam's given for us. So if people want to look at and find out a little bit more about the outcomes on that research, that's already available online. So thank you for that. I think I'm going to wrap up, Paul, and pull it together as we're just approaching 8 o'clock. So from my point of view, just a really huge thank you to the Cambridge team. Really appreciate you taking the time this evening to speak with us again and share your slides and materials with us. The recording will be available on the dachshund-ivdd.uk website in the next couple of days. Thanks also again to Sue Bluffield and Lynn Hall from Dachshund Rescue, who joined us this evening, who are donors to the research project that Paul and the team are carrying out. And can I give a special thank you to Victor Zapesi, who created the Dachshund Health UK logo. Thank you, Victor, for that. I hope you liked seeing it on all the slides that Sam put together this evening. So I'm going to just finally hand over to Paul to say a wrap-up comment, and then I'll stop the recording and we'll close the webinar for this evening. Thank you very much, everybody. And thank you to everybody who bought a ticket. All the proceeds will be going to the Cambridge Research Project. Paul.
Yeah, well, I mean, just reiterate what you said. Thanks so much to everybody for turning up. Thanks for making it such an entertaining and interactive session with all the interesting questions at the end. I hope we managed to answer at least most of them reasonably adequately with the time that we have. Thanks again, especially to Dachshund Rescue UK, to Dachshund Health, to the Kennel Club for really generously sponsoring our work, because none of this would be possible without you guys. And as Ian said, the webinar will be available to watch. I think potentially it will be available also on the Dachshund Rescue Facebook page, but certainly that's another one you can look for the webinar. Any more questions or advice? Potentially, we are contactable through the Facebook page, as Sam said. Anyone who potentially has a dog that they think might be a candidate for the medical management study that Sam's carrying out, feel free to contact him, contact us. Sam's very, very quick to get back to people, very, very helpful, as I'm sure you can imagine from his presentation this evening. And we hope over the course of the next months and years to have some more exciting findings for you. Probably we'll have some more webinars, I'm sure, over the course of the next year. But just, yeah, thanks very much to the team, to our sponsors, and to everyone for turning up.